Hi everybody, welcome to PharmaExplora. Today we're going to talk about another healthcare system model in detail, the out-of-pocket model, paying the price. Before we begin, I'd like to remind you that we've previously discussed what a healthcare system is, provided a brief overview of 4 basic health system models in the world, and covered the Beveridge, Bismarck, and National Health Insurance models in detail. You can watch those videos from the links provided in the description. Now, let's begin. People must pay for their healthcare in many low- and middle-income countries. Although there might be some government help, most people still have to cover their medical costs. This can make it hard for many to afford the care they need. Understanding this model's dynamics and complexities is crucial for recognizing its challenges and exploring potential solutions. Personal payment, limited government support, and a market-based system are the key features of the out-of-pocket model. Now let's take a look at each feature separately. Personal payment. People usually pay for most of their healthcare services themselves, such as doctor visits, medicine, and treatments. This can be a heavy financial burden, especially for those who are poor or sick. Limited government support. Unlike other systems where the government plays a bigger role, here the government mostly just regulates and might give some help to specific groups. But this support often isn't enough to cover everyone's needs. Market-based system. The healthcare system works like a business, where providers set prices and people choose services based on what they can afford and what they think is worth paying for. This can lead to differences in access and quality of care, depending on how much money people have and where they live. Here's a step-by-step description of how the out-of-pocket model operates. This model consists of 5 main steps. Individuals pay directly. Unlike other models with insurance or government funding, the out-of-pocket model places the primary financial responsibility for healthcare directly on individuals. This means patients pay for most healthcare services out of their own pockets at the time of receiving care. Limited government role. The government's role in this model is often limited to regulatory functions, such as licensing healthcare providers and setting basic quality standards. It may offer some targeted subsidies or programs for specific vulnerable populations or services, but these are typically limited in scope. Market forces drive the system. Healthcare services are primarily provided through private providers, operating on a market-based approach. Providers set their prices based on supply and demand, and individuals make choices about care based on their affordability and perceived value. Accessing healthcare when needed. When individuals require medical care, they typically seek out providers directly and pay upfront for consultations, medications, procedures, and other services. There's no insurance card or government coverage to rely on. Financial barriers and inequities. The direct payment nature of the out-of-pocket model often creates significant financial barriers for many individuals, especially those with low incomes or facing chronic illnesses. This can lead to delayed or foregone care, exacerbating health inequalities. Now, let's talk about the challenges and considerations associated with the out-of-pocket model. Financial barriers and inequities, inefficiency and inequity in service delivery, and vulnerability to price fluctuations and abuse are considered the main challenges and concerns of this model. Financial barriers and inequities. Paying out of pocket can make people delay or skip necessary health care, which hits vulnerable groups hardest and worsens existing health inequalities. Inefficiency and inequity in service delivery. The focus on market forces might not encourage spending on preventive care or public health, leading to wasted resources and higher costs in the long run. vulnerability to price fluctuations and abuse. Patients can face problems with fluctuating prices and unfair practices in unregulated markets, making it harder to get good quality care. The out-of-pocket model remains the primary way people pay for healthcare in many places around the world. Understanding its problems has led to important efforts, such as increasing government assistance, ensuring clear rules, fair pricing, and high-quality care to protect patients and build trust in the healthcare system. Knowing how the out-of-pocket model works helps you advocate for fairer healthcare access, support efforts to address its issues, and push for long-lasting solutions to improve healthcare systems in low- and middle-income countries. This is a brief overview of the out-of-pocket model. By learning more about different healthcare systems and how they function, you can contribute to better discussions on improving healthcare, support fair access to quality care for everyone, and advocate for lasting solutions to global health issues. It's important to recognize that these models are not static. Many countries use a mix of different approaches to meet their own needs. To ensure healthcare systems work well for everyone, we must continually adapt, try new methods, and discuss what works best. Thanks for joining PharmaExplora today. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more engaging content. Let's meet again with another interesting video.